So I'm so excited today. We are here with one of San Antonio's premier plastic surgeon. I would say not just in San Antonio, I think you're one of the best in the U.S. With Dr. John Ayala.
Thank you. Thank you so much for inviting me.
Yes, thanks for being here.
My pleasure.
So I know a lot of people don't get to see and know who these doctors are that is performing all the beautiful work around San Antonio. So I thought we would, introduce you today so you could share with the world who you are and what brought you into plastic surgery.
Well, I consider myself just a native Texan, a native to San Antonio.
Okay.
My parents were born and raised here. I've always loved the San Antonio as a city, and I've always loved the people of San Antonio, and I felt like I needed to do what I could to provide a service to the community. So that's the reason early on I knew I wanted to come back to San Antonio. It's who I identified with, the people here, the wholesome, generous sincerity of the people of town. So I got my education mainly in UT in Austin as an undergraduate, and then I went to Baylor College of Medicine in Houston, and then Texas Tech for general surgery, and then returned to Baylor College of Medicine in Houston for plastic surgery. And I did a 3-year program there. I graduated in '99. So I've been in San Antonio in practice since 1999.
Wow,
and,
since '99.
So it's been a wonderful journey for me, yes.
So I'm curious, because I always think with doctors, you're just, most doctors are doing a procedure. Mm-hmm. But when you're a plastic surgeon, you're an artist. So every patient is different, every case is different. So what made you decide to get into plastics? I mean, that's a big...
Well, I think early on, even before medical school, I always felt like I gravitated more towards artistry, and that was where I felt the most comfortable. Mm-hmm. I really felt like I had, I guess, somewhat of an identity as an artist in childhood. In grade school, actually, in 6th grade, I actually was asked to by the teacher to teach art to my fellow classmates.
At 6th grade?
6th grade.
Wow.
And and I actually entered my first contest, an art contest in the state of Maryland, because my dad was in the military, so I kind of moved all over the place. And in Maryland, I got my first blue ribbon for our first competition. I think in art, I felt very comfortable doing it, and I was recognized by my fellow classmates as an artist. And then later on, we moved back to San Antonio, and I felt that even in medical school, that I wanted to find something that really kind of allowed me to exercise more of the artistic skills that I had acquired at a younger age. And so that's the reason I think when I rotated in plastic surgery, I realized that this is what I identified with. This is where I felt I belonged. And I remember early on when I did my rotation in plastic surgery as my third year in medical school, is that I came home and I said, I didn't feel like I was actually working. I felt like this is something that was just a joy to go to and do, to provide this wonderful ability to create something so beautiful for so many people. And I just knew that right then and there, this is what I wanted to pursue.
Wow. So when you worked on that first patient, and I can just imagine when you are doing plastics, most people have something that's bothering them, or there's something that they want, to make them feel better, have better self-esteem. I mean, how did that feel knowing that you impacted their lives? I mean, it's life-changing in some cases.
I felt like I was, in a way, privileged that someone would come to me to have them, give them something that they've always wanted for so long. And that's why I've always approached my patients that way. What can I do? What it is that bothers you the most, and how can I help you in that regard? What can I do to make your life better? And so I always felt like if I can do that, then that would be the most blessed gift I can give someone, or I can give myself too. It's so gratifying knowing that you're able to accomplish something for each and every patient to make sure that they achieve the look and the self-image that they want. Of course, not everyone's an ideal candidate for plastic surgery, but it's for those that, if there's a identifiable, if not condition, deformity, or some kind of alteration of their body that they didn't like, it's something that can be addressed, then I'd be honored to be the person to help them with their endeavors, yeah, for sure.
So how do you set expectations for your clients?
I listen to them. That's the most important thing. You listen to them, you get an idea of what it is that bothers them, see if they have realistic expectations about how they want to look, and then go from there. And always address what bothers them the most. That's what I always do. So if, let's say, they come to me for a rhinoplasty, then I will look at their nose in the way that they see their noses. And then I look to see if the most obvious deformity is, let's say, a hump on the nose or a plungy nasal tip or a wide boxy tip, then I want to make sure that when I do surgery on them, that I actually am addressing those issues. And I prioritize the issues that are concerning to them, so that I can deliver and give them the look that they want.
That's great.
But also setting them also up with what are the limitations of surgery. I don't want to kind of give them unrealistic expectations of what they might not look like, and I wanted to make sure that they're kind of somewhat grounded in what they can expect with surgery.
And so you do that just by, you said, listening to them and exploratory
Absolutely.
conversation,
Right.
just to see.
Right, and sharing before and after photos of other patients that have similar deformities, similar conditions, so they can actually identify with how that person looked before and then what they can expect afterwards to some degree.
Wow, that's great. So we live in an age today where social media is just so present, and it seems like younger women are getting more and more into plastic surgery. And I even think there's some body dysmorphic disorder going on. How would you handle a young woman coming in, wanting to change, something about her? Is that something that you've had to deal with?
I think it comes with the experience, being able to assess someone. If they come in and they have this over-exaggerated notion of that they look a certain way and they really don't, then I would do my best to kind of steer them in the right direction, and maybe even decide to decline their surgery if I feel like I can't. Early on I realized that you can't make unhappy people happy, even with plastic surgery. There's no way. So you have to make sure with experience, and it just comes with taking due diligence to make sure you can kind of weed out those people that are not candidates for surgery. And sometimes it might be a little bit of a challenge, especially if it's someone you know. But sometimes letting them know that there are certain limitations, then you'll have a better outcome, I think, in those patients.
So going back to social media, we have so many plastic surgeries on there, plastic surgeons on there now, and they're before and afters, and you've got different angles, different lightings. I mean, as a patient, how do you know what's real and what looks good, and what could they expect, from a real before and after? Because I've seen some that are doctored.
Oh, absolutely. I really don't focus too much on social media, unfortunately. No. But I know it's become more in the forefront in terms of patients being somewhat aware of plastic surgery. I have to do is educate patients. I'll let them know, okay, if they have a certain look that they want to go for, maybe they want to look like a certain celebrity, I'll let them know, like, well, this person has a great result, but this is how this person or celebrity differs from your characteristics, and point out the differences and let them know that they may never be able to achieve that look, and ground them in that sense, and then show before and after photos of other people that look similar to them.
That's great. That's great. So it seems like a lot of plastic surgeons have, I don't know if it's a favorite surgery or one that they have their own spin on. I mean, would you share with us like what your favorite procedure is to do? Or
I've never been one to follow along and to follow the trends. I think trends, many times, I've been around a while, and I know that they come and they disappear a year or two down the road. So I think being able to ask yourself what makes sense, and being able to say, okay, I can achieve this realistically, then if you stay grounded in that regard, you'll actually be able to deliver more predictable results and better results. And I think you're going to see that after a while, you know your limitations as a surgeon, and you know you're not going to oversell, upsell anyone on anything. And being as truthful and honest with those patients as possible is really something you can never compromise on. You shouldn't.
Yeah. So what can a patient expect in the aftercare, and how much of the aftercare of a surgery is on them? I mean, you've done your job. What about them doing their job?
I think it's a shared concerted effort for both the surgeon and the patient to be able to achieve an optimal result. I think you have to do is educate the patient as best you can, and to be attuned, listen to them and listen to the concerns that they may have. And kind of see them frequently after surgery. That's what I like to do. I always see my patients the day after surgery, so I can assess their how they recovered and make interventions if I need to intervene and correct things that need to be corrected. But I don't know what else I could say about that. But
Well, you did my facelift, and I'm only 6 months out now, and I was so impressed with, first of all, the whole research thing. I mean, there's just so much data and information out there trying to weed all that out. I mean, how would a patient that doesn't know you, how would they go around and, I guess interview a plastic surgeon or do consultation? What questions would they ask to get to know they're getting a good,
You need to ask them what it is that they would do. First of all, ask them if they're comfortable doing a certain procedure. Mm-hmm. Ask your friends who they would recommend, because usually it's word of mouth is very powerful. I mean, in terms of selecting for a surgeon. Also, look at their before and after photos to get an idea to gauge in terms of how the quality of the workmanship is, and also ask the surgeon technical questions that you might be aware of. Maybe doing some reading, maybe YouTube videos, looking at those, and just getting an idea of what's involved in the procedure. And if they fail to mention certain things, like say a drain needs to be placed for this procedure, then maybe you need to think about other surgeons or consider others to maybe give you their opinions. I know what I do is I studied a lot of the research and literature before I started doing a lot of surgeries. Like say for a facelift or a rhinoplasty, I looked at the very, very best experts in the fields, and I looked at their publications. I looked at what made sense to me, because there's a lot of bad, even well-known surgeons do not exercise good techniques. And I would, in a way, ask myself what it is that makes sense to give the results that I want. Mm-hmm. Let's say when it comes to a facelift, it's the jowling that bothers the patients. Mm-hmm. So what is the best way of correcting the jowling? Well, you have to understand how people get jowling. It's from gravity, or causing our tissue, soft tissue, to descend over time. And as it descends, you get the nasolabial fold, you get the jowling, and that's genetics. But you can do things to reverse that, and there's ways to do it naturally to give you the most natural results. Okay. And one of them is to realize, okay, our soft tissue doesn't descend vertically downwards. It actually does descend vertically downwards. It doesn't descend in an angle. So lifting the tissue back directly upwards is the best way to restore that cheek fat, to give you that nice sculpted look and to correct for the jowling. So I look at that, what makes sense. And then tissue tightening, it has to be done in a way that it's going to be effective, let's say along the cheekbone, to give you that nice augmented look, but not an over-exaggerated look. And it also applies to the neck, knowing that there's different layers of soft tissue. You have to debulk the areas that need to be debulked, or tighten the areas that need to be tightened, and then address the other issues in redraping the skin and do it in a natural fashion. So there's all these different techniques that are out there that you, as a surgeon, have to decide as to whether you want to apply that technique or not to a given patient. It also applies to all the other surgeries, regardless of whether it's a nose or a tummy or whatnot. But do things that make sense to you, and also over time, just doing the surgeries, you can actually get more experience in terms of what's effective and what isn't.
So, today we see so many maintenance things that we can do to prevent surgery. So what does aging gracefully even look like today?
As someone who's, it starts with nutrition, proper nutrition, and so that you can maintain your ideal body weight. I think it's important. Also, protecting your skin from overexposure to sunlight, because there's ultraviolet damage that's occurring on a regular basis just from continual exposure to sunlight. You may not be aware of it, but it's going to affect you someday. Also, making sure that you avoid certain things that accelerate the aging process also, which includes tobacco use, alcohol use, and things like that can really help you. Certain skincare regimens can also be effective to reversing the facial aging that might occur. Let's say retin-A products, retinoids, tretinoin, things can be effective in helping to reverse the aging process. Botox too is effective.
Botox, yes. We love our Botox. And so I know I've heard a lot of people say, what age is the proper age to have a facelift? And
I don't think there really is. You can say each and every patient's unique in that way. Some patients had a lot more stress in their lives. Some patients have, genetically, they're not at an advantage. Or people that have certain bad habits, smoking, alcohol, that will accelerate the aging process. So it's on a case-by-case basis too when it comes to that. But most patients would consider doing a facelift, usually maybe 40s to 50s.
Okay.
And people, believe it or not, that once you have a facelift done in the 40s or 50s, the scar tissue that occurs with the facelift many times can help to slow down the progressive descent of soft tissue over time. So you're probably going to look even better in your 60s and your cohorts or your colleagues that don't have that kind of work. The thing is that not every surgeon does the same type of facelift. And that's where I think the public needs to be aware of that. Not every surgeon's trained the same.
Right.
We don't have the same skills. The skill set's different. Like some have an artistic eye, others do not. And you can't teach that. I tell people that all the time. It's like a really good all-star athlete playing basketball, like LeBron James. You can't teach his athleticism, and it's something he's born with. Just like artistic skills when it comes to plastic surgery, you can't teach that. You're born with it.
Right.
And you can just hone those skills. You can learn what techniques work, but applying those skills in the OR, it's basically depends on the artistic eye of the surgeon to do it.
Right.
And but getting back to what you said about facelifts, for instance, if you do a more comprehensive composite facelift, you're going to get a longer lasting, better result than if someone who does a lifestyle lift or someone who does a very limited lift. And people don't realize that the aging of the face occurs primarily between the eyes, not lateral, but a lot of limited facelifts are done lateral to the eye. Really, there is very little improvement to the medial face that you really need to address. And so many people think, I'm going to get a good look with a limited facelift or a lifestyle lift, and it's really not going to be effective in the long run. And many times your hairline might be altered and pulled back too far back, which doesn't look good either.
Yes.
So you have to be mindful as a surgeon not to alter the hairline.
And so that kind of leads me into I know a lot of people, including myself, when I was very concerned about scarring. And you can't cut into something without having a scar. However, your procedure and the way you sew them up can definitely have, or wear. So tell us a little bit about, how you minimize the scarring.
There's a lot. I apply the techniques I think some of the masters when it comes to facial aesthetics have implemented. And for instance, you can actually get an even better scar, a more inconspicuous result or resulting scar if you hide the scar in certain crevices of the ear, around the ears, and in the hairline. For instance, the helical rim is a good indication where you can actually place the scar right in the helical rim. It's less noticeable than if you place it in front, or behind the tragus versus in front, around the earlobe. Little subtleties like that can make a huge difference in terms of diminishing the appearance of scars. Also, the submental crease we all have. We think intuitively you can place a scar in that crease. Actually, the experts say no, you shouldn't place it in the crease. You should place it behind the crease. That way it doesn't accentuate and deepen that crease even more, which creates more of an obvious result of a facelift. So there's little tiny tricks you learn along the way that actually help to achieve an even better result with less visible scarring. As a surgeon who wants to exercise good technique, you should think about hair patterns, and you should think about not distorting the ears. Those are things that are important. So you can alter your hair position by misplacement of putting a scar in a non-ideal location, placing, let's say, like a lot of doctors do in the scalp. What happens though is that many times if you're lifting the skin to tighten the skin of the cheek, the hair line is going to be pulled even further back, and you may actually have your sideburn pulled over your ear, which is not ideal. Right. And also, a lot of doctors, plastic surgeons that do facelifts, even to this day, they think the ear is going to support and sustain the tension of the pull of the facelift. It's not designed to do that. So many times these patients will end up with what we call pixie ear deformities.
Yes.
Where the earlobe is on tension, it's when it's closed, and it's very, I would say it looks very eccentric or very odd. So to avoid that, you want the tension to be away from the ear. So there's certain techniques you can apply so your tension is on the scalp and not on the ear itself. So it makes it even more natural, and in your ear, and you're having the facelift scars, they're not causing any distortion of your ears at all. So it looks so much better.
So I know we covered a lot about the face. What about the body? I know even like women that are getting like mommy makeovers and all of that. I have a great friend that used you, and she looks amazing, and she researched people all over the world. She was willing to go out of the country, and she ended up here with you in San Antonio, which is awesome. But talk about your body. What kind of scarring would you expect, like say on a breast lift or a tummy tuck or something where a mom is wanting to feel a little bit better after having kids?
Well, when it comes to the breast, you have to make sure you prioritize the shape and form and symmetry. Those are important. Scarring, I think, will take care of itself if you can reshape the breast so that the breast mound is where it belongs, where it needs to be, above the inframammary folds. And you don't want to elevate the breast mound too high or too low. It has to be just right. So you can use your anatomical landmarks to discern in terms of where the nipple needs to be positioned and the center of the breast needs to be positioned. That's what I like to do. So I start from the ground level and in the basic center of the breast and kind of alter everything according to that. And I believe it helps me achieve a better result, I think, aesthetically. And the scarring, if you close skin in layers, you're going to have an even better result if you just close it in just one single layer. And also diverting the tension and the weight of the breast has to be diverted away from the closure to really get a good result. And nipple and areolar positions also can be altered. The nipple and areolar shape can be altered if you have too much tension on the closure, so it has to be done just right. Yes, when it comes to the abdomen, everyone wants that hourglass figure. So there's certain ways of achieving that. You have to be cognizant of the tension and the pull of the soft tissue to really achieve that look. You want to tighten the abdominal wall just enough, but not too much. They might have issues with straining, or issues with bowel movements if you tighten it too much. But you also want to correct for any kind of diastasis that might exist. Also, liposuction to resculpt the abdomen is also something I implement in my tummy tucks. It really helps give my patients that flatter, more athletic looking abdomen. And when you do the closure, you also want to make sure you give the patients a low scar, because that's really important, I think, for any patient to have a scar that they're not going to be able to see as readily as if it was really high in position, because you can't really hide that. When you get out of the shower, you don't want to see this large scar across your abdomen. So the lower position scars tend to heal better and look better. So I'm all about having a beautiful low position scar, a nice hourglass figure, sculpted abdomen, and restoring the muscle tone that they sacrifice, let's say with childbirth or with weight gain and weight loss. And so there's certain techniques I apply to give that really taut look and a low position beautiful scar. So there's little kind of subtleties that make a huge difference in your results. Now, many people also under the misconception that if you want a really good result, you have to go to Hollywood, someplace like that. And that's so true. That is not, it's actually opposite, actually, in my opinion. I think people that are somewhat limited in their abilities as a surgeon would probably consider going to Hollywood, because they're going to use the name of Hollywood to drive their business. I mean, it's not true. Just because geographically you're in a certain area doesn't mean you have some special gift. Actually, it's harder to be more successful as an aesthetic surgeon outside of these populous cities, like say LA or Hollywood, or I mean LA or New York.
Beverly Hills, New York.
Absolutely.
Yeah.
And people that can do what they do and be successful in lesser known cities probably have a lot more skill than many people might think.
That's a good point. Well, I'm glad you're here. I mean, San Antonio's lucky to have you. So that's a really good point. And so when you think about looking for a surgeon, it's like it's so easy to just Google it and see who shows up, in the front. But how many consultations would you suggest a patient have before they make a decision?
I think you can go overboard. Not to say, I would think maybe 3 is probably good enough. I mean, for people to get an idea of who they connect with, who they feel is they feel more comfortable with. I think that's important, and it should be sufficient. I think for most people. Also look for someone who's board certified. I think it's important too.
Yes.
In plastic surgery. Facial cosmetics really apply for someone who's trained in just above the neck or higher. When a board certified plastic surgeon is trained in the whole body. So that's a huge difference. So make sure you're looking for a board certified plastic surgeon.
How would somebody get in touch with you specifically? Because I mean, I want to put you out there because I'm just really impressed with you. Everything from, when the front office to the aftercare. I mean, you did meet with me immediately the next day, and you were just, the whole staff was fabulous. I know you're so booked and you book up quite quickly. How would somebody either that's not from San Antonio, let's say somebody from out of state wants to come and visit you, how would that work?
They can find us on our website. It's ayalaplasticsurgery.com.
Okay.
Or they can call us directly at the office. It's 210-692-FACE 3223.
I like it. FACE. I love it. Well, thank you so much for joining us today. This was great, and I hope it gave everybody, some insight to the world of plastic surgery that's just becoming more and more popular.
Well, thank you. Thank you so much. Appreciate it.
Thank you.